Hi, I'm Carrie Mulherin. This presentation covers where the Brava high-sensitivity troponin test fits into the care pathways for managing chest pain. European and U.S. guidelines are driving the shift to high-sensitivity troponin assays. Brava will be among the first point-of-care systems to meet the sensitivity and precision metrics of those guidelines in a point-of-care system. A heart attack is defined by a cutoff that is based on the 99th percentile of a healthy population. The guideline calls for precision of less than 10% at that very low troponin concentration. High-sensitivity troponin tests run in the central lab deliver high quality, but turnaround time is often 60 to 90 minutes. Current point-of-care tests are fast but don't meet these guidelines. We get to that 99th percentile by running apparently healthy subjects to establish the reference range. The green curve shows the normal distribution of a concentration for these normal subjects. The green line depicts the 99th percentile. We run a clinical trial to determine concentration for patients with disease. This table shows the 99th percentile for the 3 FDA-cleared core lab assays. Note that the numbers are different for each assay and for men and for women. Here are the numbers associated with point-of-care assays. The Brava test will have sensitivity comparable to the core lab high-sensitivity troponin assays. That's an order of magnitude better than the market leader iStat. There are 8 million visits to U.S. emergency departments for chest pains each year, and 1 million people get a diagnosis of heart attack. When a patient comes to the ED, the care team does a history and physical, an EKG, and draw blood for a troponin test. About 3.5% of those patients will have EKG changes that indicate a total blockage or a stent. That leaves 7.7 million people needing further evaluation. About 35% will be discharged with non-cardiac diagnoses. But 5 million patients are admitted, and only 15% of those ultimately get an MI diagnosis. These excess admissions are often due to slow or equivocal lab results or fear of being sued for discharging inappropriately. Implementing high-sensitivity troponin assays could result in flipping those admission statistics. Of the 7.7 million EKG negative patients, 10% will have troponin levels above the 99th percentile cutoff, and they'll be admitted. 30% will have undetectable troponin levels, and they will be discharged safely. That leaves 4.6 million who have measurable troponin but not above the cutoff. A second troponin test will be done in 1 to 3 hours. If there's no change, it is likely to be a chronic condition like heart failure or renal disease. The patient could be treated in an outpatient setting without adverse outcomes. If the troponin level changes, the patient is admitted. This care pathway results in 2.6 million fewer admissions than the standard of care. That's a $7 billion savings to the healthcare system. This graph plots the 99th percentile concentration against precision for commercial assays. These are the high sensitivity assays with low concentration and CV less than 10%. This is where Brava will be on the map. These are the contemporary assays that will be replaced. These are the current point-of-care assays that don't meet the guidelines. Cost and turnaround time are also important. Brava competes favorably in these dimensions. Thanks for watching. Please contact us to learn more.